Okay, let's dive into a critical issue facing medical AI, the reproducibility crisis.
Remember during COVID, researchers were racing to build AI to spot the disease on chest scans?
Well, a major review took a hard look at 62 of these promising AI models.
And what they found was pretty wild. None were reliable enough for actual clinical use.
So what on earth went wrong? How could so many of these promising models just fail?
See, in the lab, these models looked amazing, reporting near-perfect results on their own data.
But take them out of the lab, and that performance completely vanished. This is the crisis.
This performance drop has a name, the generalizability gap. It's a huge challenge for AI.
So why does this gap happen? It really comes down to internal versus external testing.
This chart really lays it all out. See the dark blue diagonal? That's the AI's home turf data.
The scores there are super high, but everything else, the performance just drops off a cliff.
So how do we fix this? How can we test these things better before they reach patients? Well, one really promising idea is something called virtual imaging trials, or VITs for short.
The idea is pretty cool. You create a digital human, add a simulated disease, and then run a virtual scan.
This gives you a realistic scan where you know the ground truth. You know exactly what's there.
And this opens the door to tests you could never ever do on real people. For example, they found the AI's performance really depends on how bad the infection is.
With severe infections, the AI was great. But for mild ones, it was basically a coin toss. They could also test physical things, like changing the scanner's radiation dose to see what happens. And surprisingly, a huge 30-fold increase in radiation barely improved the AI's performance at all.
So you see, these virtual trials are an amazing toolkit for building AI we can actually trust.
Now, to be clear, these don't replace real-world trials. They're designed to make them better.
Think of it like a flight simulator for AI, a safe place to test it before the real thing.
So, could these virtual patients finally make AI a partner we can trust in our healthcare?